The topic for today's discussion is, when do you feel the baby movements? Hello and hi everyone, this is Dr. Sravanthi Reddy, fertility specialist and gynecologist at Shubha Fertility, LB Nagar. So the topic for today's discussion is, when do you feel the baby movements? Very commonly asked question. So the movements of the baby are seen as early as 11 to 13 weeks in the ultrasound, but the perception by the mother when she feels the movement is depending upon where is she primigravida or is she multigravida. Primigravida means if she's first time pregnant, or multigravida means she's been pregnant already. So in primigravida, what happens is that she doesn't know the movement, so it might take a little late. But the perception of the movement, it is called fetal quickening. The first time the mother perceives the movement is called as quickening. So it is felt around 18 to 20 weeks. And in multigravida, it can be felt around 16 to 18 weeks. So multigravidas, they already know the movement perception, so they feel it little earlier. Whereas in primaries, it is very difficult for them to assess how the movement is, so they almost feel the perception around 18 to 20 weeks. They'll be worried that it is not, we are unable to perceive the movement. It is very common in primary gravida. They'll perceive little later, and the movement will be like it will be like flutters or tiny pulses or like swishing movement. So when they get the perception once, they'll understand it is okay, it is a fetal movement. So they have it, because in primaries they don't know how the movement is, so they're always worried, I don't have movements, I'm not perceiving it. So once they get that the sensation of that movement, that flutter movement, they'll understand, and when they get pregnant next time, they'll know it they'll know it so better, so they'll perceive it earlier in multigravidas. So how do you assess the fetal movements generally? So in earlier, once in 20 post 20 weeks, you'll just see whether the movements are there or not. But when later trimester, after 28 weeks, it is always better to assess your fetal movements. See, the fetal movements are a better judgment to see how your pregnancy is going on. So generally what we advise to the patients is, you can't throughout the day you can't go on measuring the movements. Generally, what is the normal movement count in a day is around 10 to 12 movements per day. So you can't count throughout the day. So what we tell to the patients is, post every meal, like in the post breakfast, lunch and dinner, sleep or just lie for 1 hour, and measure at least within an hour you have to have at least 3 to 4 movements. So if you take it as a total, it will be around 10 to 12 movements. So if you can perceive movements like that, it will be better, so that you'll have a correct calculation, correct idea that baby is growing well or not. So even if you don't have movements, you can just drink something hot, like hot tea or hot coffee, and just lie down and see if the baby is moving or not. See, this is very alarming to the mothers if the baby is not moving. Sometimes it might be a condition where you are in a conditions like low liquor is very less, oligo or hydramnios. In such cases, you might not perceive the movement, and in cases with polyhydramnios also, where the liquor is more, baby will be moving, but you don't have that perception. So in such conditions, it will be it might patient might think that baby is not moving, and it might something is happening to the baby. But it is always better to check your fetal movements, and immediately if the baby is not moving, once, even if you drink hot water or eat something, and then try that, if there is no perception of movement, it is always better to consult immediately the obstetrician and get a scan done, and go and meet the doctor, so that you'll be evaluated correctly whether the baby is going well or not. So this is how you have to monitor your movements throughout the day. Thank you, and follow me for more content.